Welcome to your Metabolics Doctor's Report. I'm Dr. Kimberly, and we're going to spend a little bit of time in here together going over your Metabolomix test results that you sent in. What happens, you sent your test results in, and my team got those test results back, and they put a recommendation care plan for you together. And today we're going to go through what those test results mean. How do these biomarkers, I'll go over in just a second, how do they get broken? How do you correct them? And that's really the process we're going to go through in this time that we have together. When we finish in here, what I'll do is I'll take you back into a private room and we'll go over your individual recommendations and make sure you have a really customized care plan for you. Now, before you came in, we did, you guys are familiar with this lifestyle risk questionnaire. So we went over this lifestyle risk questionnaire, and all of your answers, those are things that we take into consideration when we put your recommendations together. And if you pull out the sheet that's sitting in your lap, this sheet here has what we call your biomarkers on it, okay? Notice how your sheet's actually blank, but the one that you see on the screen actually has multiple colors on it. We've made one for you that's customized for you, but this one in front of you is blank. If you want to take notes on it, that's fine. What you'll see on here is we tested. If you flip through the pages, we tested a lot of things, yes? And so if you just look through here, you can see just on the first page like vitamins and minerals and GI support. You can see down there at the bottom GI support. You can see the next page has things like yeast. So whether you have, maybe you have malabsorption or dysbiosis, abnormal bacteria, leaky gut, even maybe yeast in your digestive tract. You can also see things like the neurotransmitters at the bottom of the page. That'll give me an indication of where you are as far as if you're suffering with, or maybe you're going to end up suffering with things like anxiety, depression, sleep disturbances, and things like that. But if you flip through again, there's like that third page has toxicity. So what have you been exposed to as far as toxins? And then what have those things done to your body? And then we're going to walk you through how to fix that. You can see oxidative damage on there as well. There's a couple markers on there. And that really, those markers on there and so many more, but those specifically really give us an indication of what kind of diseases you may be setting yourself up for. So if those markers are broken, those are very serious markers. And I'm going to walk through, I'll show you some flags. It'll show you if you have a risk for cancer, if you have a risk for diabetes, if you have a risk for autoimmunity. That is literally in this test. So this is going to be able to show you if you have that risk, and we can walk you through the process of being able to correct it. The other thing that I want to make sure that you have a good understanding of is, as I'm saying some of these words, your faces are kind of like, uh-oh. I just want you to know that I've been doing this testing for 9 years, and we've seen people with risks of cancer or even had cancer or leaky gut or autoimmunity. We've seen it all, diabetes. And what I can tell you is that when you get this test back and you get your recommendations and you follow them, I've seen all of these biomarkers heal. So I just want you to be encouraged about that. I know some of these things sound a little scary, but just be encouraged and know that all of these things can and do heal. Again, the list of what it is that the things that we test for. I didn't even touch on amino acids, but I'm going to walk through heavy metals. I'm going to walk through some genetics. Some of you had genetics testing done as well. And so this test will show you whether you have a risk of genetic profile risk that maybe mom and dad pass on to you, and then what it is that we can see whether you've actually triggered it and you're actually starting to manifest some of the things that mom and dad maybe have passed on to you. So we're going to go through that in this talk today. One of the things that I always like to tell people, they ask me like, why do I do this? And I'll just say big picture, heart reason why I do this is because of my family. Right? That's really why, the primary reason why we do anything. My husband was the primary reason why I started doing this testing over 9 years ago. Most of you know, if you're a patient in the office, that we opened a clinic in Zimbabwe, Africa. And when we were over there, both my husband and I got very sick. And my husband's tests actually showed, when they looked at his test results, they said, we don't even know how you're still alive, and we don't even know how you're still standing. And so when my husband got back from Africa, the symptoms that he was struggling with is he was having a hard time waking up in the morning to come to work. In fact, he'd never drank coffee before, and suddenly coffee was born in our life just to be able to get him up and out of bed. And it was the kind of, I don't know how I'm going to get up out of bed, that would bring you to tears. Like that kind of tired, that kind of fatigue, if any of you guys have ever known anybody or experienced that. it was that kind of fatigue. And so he would end up at Starbucks, and we had a huge bill from going to Starbucks, and he would come into work, and literally our day was adjust a patient, and he would lay on the ground. Adjust a patient and lay on the ground. And the primary job of our staff was to take care of him so that he could take care of the patients. That's how bad it was. And so when I tested him and I got his test results back, literally, you see that page, all the list of biomarkers, all of his biomarkers were broken. So you can see why they would say something like, I don't know how you're still standing or how you're still alive. And so we took my husband through a process, and it was tough. The average patient will go through a recommended care plan treatment for about 4 months. That's about the average time period. My very serious cases, they might be 6 months, okay? My husband fell into the 6-month category, very serious. We get 4 months into my husband's protocol, and he says, I am sick of this. I don't want to do this anymore. I'm done. And so you can imagine I'm his doctor, right? I told him, what did I say? I'm like, you're a bad patient, as I said first. And then I said, okay, fine. So we go on vacation literally right after that, and we get 2 or 3 days in our vacation, and he says, did you bring my vitamins? And I said, no, you were mean. And he says, I know, I'm so sorry, I'm just so frustrated. And so, like many of us experience frustration, right? In the process of just trying to get better. He gets home and he starts taking his supplements again and follows his routine exactly to the letter. 2 weeks further into his program, and now suddenly his energy is coming back. So much so that coffee he stops drinking, and CrossFit, he starts doing CrossFit in the morning before he comes to work. That's the difference in his energy. So about 4.5 months-ish into his protocol, he's like, hey, I feel so good, I'm going to go do CrossFit. Now that's a stark difference between somebody coming to work and laying on the floor in between each adjustment, right? So when we retested my husband at 6 months, all of his all of his biomarkers, everything had healed, everything. A dramatic difference between someone who could barely get out of bed and was in tears and had to lay on the floor in between adjustments, and actually now is doing CrossFit and not laying on the floor, and he actually gets rid of coffee. So I tell you that just to say, you know, I've been there, I've been in this situation, and we do this because it's changed my family's life. And so we really want to make sure that we can bring this to you guys as well and really experience the miracles that we've been through in our own family. My kids have all been tested as well. They have their own testimonies, just very powerful testimonies, but all of us were tested, and they all have had some sort of amazing miracle testimony in their own body as well. So what are the basics of metabolism? I like to use the analogy of metabolism of your car, and metabolism to you is like gasoline to your car. So if your car has no fuel in it, it's not going to go very far, right? And your body's the same way. If it has no fuel, it's not going to go very far. Where for us, fuel, what makes fuel is what? Our food, right? Our vitamins, right? And the fluids that we drink, that's what makes fuel. And so if you're not getting the right fuel in, then your body's not going to really work the way that it was designed by God. That's the best analogy I like to give just regarding metabolism. A lot of times people are associating that just to weight loss, but it's really just your body's ability to be able to function and fuel. So I get asked this a lot. What are things that cause us to age? And I mean like not just age like wrinkles on your forehead. I mean like age, like everything feels old and broken down. Well, we tested all of that. That's the good news. So we're going to test all of those things. And aging, like your joints breaking down, like your organs not functioning the way they should, that kind of aging. These biomarkers that we tested for, those are the things that will show us why we gain weight, right? A lot of people wonder why we gain weight or why we can't lose weight. Really, better yet, cancer, heart disease, diabetes, and all kinds of other autoimmune types of disorders. These types of things that we tested for, they will, if they're broken, those are the things that will set us up for these types of diagnoses. Now, what I love about Max Metabolomix is that this test is so sensitive, it can test things on you and show them as a flag long before the diagnosis actually shows up. And I don't know about you guys, but wouldn't you rather like know way ahead of time that you are headed to autoimmune disease so that you can actually prevent it and course correct and change direction? And I always say, like, you can change direction and head right back to the 5 essentials, which is part of what we're talking about today in the 5 essentials. So big picture, I really want you to get this piece if you get nothing else, okay? I want you to get the ABCs of biomarkers. So how do these things get broken? For example, you saw the colors, right, on the first sheet that we showed you. When you go back, if you see colors on there that are red or yellow, like, you know that these biomarkers are broken, okay? How do they get broken is really important. If do you guys remember the Krebs cycle or glycolytic pathway? Those of you, most people are like, don't even talk to me about that. I won't make you say any of those names. I promise they're really hard to repeat, but I want you to get the big picture just so you can kind of take this home. If this is a math equation that takes place in every one of your cells, and that math equation looks like this. A goes to B, B goes to C, and C goes to D. And notice every step along the way has a required cofactor. So let's just use the example. A goes to B, and it requires zinc in order for it to move on to C. If your test results come back and you don't have what is required in that pathway for it to work, i.e. zinc, then what happens is B will spill into the urine. So you sent your samples off. If B spilled into the urine, we know why it spilled there. Why? Because you need what? Zinc, right? And what's beautiful about this test is it will tell me how much zinc you need too. Because sometimes maybe we'll go, yeah, we just need to take zinc, and then we don't know how much. So then we don't really move the needle in being able to heal the pathway and actually be able to make ATP or energy that our body needs, okay? So that is the big picture. Like, literally, that's the one most important thing I want to make sure that you get is this biomarker sheet right here, this biomarker explanation. And also just an explanation of that this actually happens in every single cell in your body. So before I go into the rest of your test, I want to make sure and just kind of pause here for a second and just make sure, for those of you who are patients in the office and you've got your spine checked, it's really critical and important for you to know and make sure that you recognize that your nerve system, God put all the power for you to heal inside your nerve system. That power is in your brain. It travels down through the spinal cord, out through the nerves. And as long as that power is actually not being interfered with, then your body can heal on its own. But what you don't want to walk away thinking is that if you just eat broccoli, and let's just say it's organic and it's the best version of broccoli out there, you don't want to walk away thinking all I need to do is eat broccoli. Because if you have a nerve that's pinched and choked off in your spinal cord that goes to your digestive system, how well is that broccoli going to help that nerve? It's not. We've got to make sure that we have a clear channel so that the nerves, the bones, are not blocking off the nerves, and we can actually heal the way God designed, right? So that's why 5 essentials. We focused on when you first got started, if you had your spine checked, your chiropractic. Now we're going to dive into a couple of the other essentials right now in this class. And just make sure if you are a patient, maybe if you have been missing adjustments, or maybe if you haven't been doing rehab, this is the time to tighten up on all that stuff. It's a great reminder because we're about to go over your test results. And if you see some things on your test results you don't like, you want to make sure that you focus in, you laser focus in on all 5 of the essentials so you give your body the best chance to heal. Okay? Make sense? Okay. All right, why Max Living products? I'll just say this. I get asked this question all the time. I've been doing this for 9 years. The proof is in the pudding. When I test patients and they follow the protocols that I give them with the Max Living products and they retest and their bodies heal, the proof's in the pudding. I'm only using the products that we have here in our office. So I just make sure everybody knows, like, if you have other stuff that you love, this is a time not to get all finicky over this. This is a time to really make sure that you get results. And I know it gets results, okay? Fair enough? All right, so we're gonna hit what does this test for? Number 1, it tests for vitamin deficiencies. I think we downplay vitamin deficiencies a whole lot, and I think we just need to make sure that we recognize with vitamin deficiencies, if you add stress to the component, well, this is gonna keep you from sleeping, it's gonna give you skin problems, it's gonna be the reason why maybe some of you can't lose weight, It's going to be the reason why some of you are having problems with depression or mood, right? Vitamin deficiencies are critically important, and we don't live in a world where our soils are super, nourishing right now, right? We're living in a time where our soils are so depleted. And so some of us, when you get your test results back, you might find out like, dang, like I really look malnourished. And so you're going to find that that's the reason that you may be manifesting some of these conditions or diagnoses or having some of these symptoms. Blood sugar imbalance. A big thing, big cause with blood sugar imbalance, there's a ton. But I'll just tell you, one of the most important things you need to understand about blood sugar imbalance is this is in your hands to change. You can fix it. And so we tell patients the chronic overconsumption of carbohydrates is really one of the primary reasons why we end up with blood sugar imbalance. And we empower you, we'll do that today, with what kind of diet, what foods should you be eating, what foods should you not be eating, so that you can actually heal that. We've had over 20 cases in the course of 1 year of diabetes heal. And that happens because we walk people through and give them very specific customized testing so that their bodies can actually have a chance to be able to do that. Consequences if you leave blood sugar imbalance, mood related, and also like cholesterol, blood pressure, all those types of consequences, heart disease, things like that will show up if we leave blood sugar imbalance. Inflammation, just this idea of inflammation, just the whole body just hurts, right? It's like angry at itself, inflammation. And so what are some major causes? Again, I'm hitting on chronic overconsumption of carbohydrates. There's others, right? There's smoking, and there's the things that we are kind of told, like, don't be drinking every day, and don't be smoking or living and hanging out with somebody who is, you're breathing that in. There's a lot of things, right? But if we just put our time and focus into making sure we're not getting this overconsumption of carbohydrates, it's a game changer in your body's ability to heal. So again, causes of inflammation and then consequences. If we leave inflammation, so if we get your test results back and we leave the inflammation, you set yourself up for everything under the sun, from the cancer, the big C word we're scared of, to arthritis that people are really concerned about, right? To any kind of autoimmune disorder that you can think of. You think of any diagnosis, you're going to see this in there, okay? This is the consequence of it if we leave this and it goes unchecked. Number 4, we test for oxidative stress. And I talked to you guys earlier, just when we opened up, just about how oxidative stress, if you have oxidative stress, it is the key to telling you whether you have a diagnosis. But what else did I say? I said it's also the thing we can show you how you can heal from it, okay? So just know, like, if this is broken, you have to take this seriously and you have to make some major lifestyle changes, okay? But we're gonna walk you through that. I like the image because the rotting image just kind of displays to you like the body is rotting, it's decaying, it's aging, this whole oxidative stress. The big thing I want you to understand is a lot of people don't really understand what oxidative stress is. And so if you think about, you guys have heard the term free radicals before, right? So anything can cause free radicals. But the term antioxidants are very important to counter those free radicals. So the term antioxidants right here. So anti means against, oxidant or oxidation. So oxidation is that rotting process against rotting. Does that make sense? So you want to make sure that you get the right amount. Now in my husband's case, remember how I told you that his test results came back and he had every biomarker broken? Well, if CoQ10 is an antioxidant and he were to only take one of those every day, and that had 50 milligrams, but his body said that it needed 600, would we ever get there? Would he ever heal? See, that's a critically important piece of information when you're getting this test result back, because my husband never would have healed if we only just, okay, you just need CoQ10, 50 milligrams. And I'll tell you, from this day, I've never had another patient need 600 milligrams twice a day. He's my most severe case that I've had regarding the need for oxidative stress. And that makes sense because his flesh was in his blood, floating around in the blood sample they found. That means he was rotting and decaying and his flesh was decaying. So that makes sense, right? If somebody's on death's door, you're going to need a whole lot more antioxidants to be able to counter that. So what are causes of oxidative stress? Ours was exposure to toxins, right? Being in Zimbabwe, we actually, they don't have a public sewage system. You don't drink the water. Well, guess what we did accidentally? So we got sick from that. And so for some people it's toxins. You know, some people it's the pollution. Others it's living near power lines and waste dumps. You know what, honestly, frankly, others it's medications. It's the over-the-counters or the prescribed medication. There's a side effect to that. You're not going to walk away taking medication and think you're going to be okay. You're not. There's going to be a side effect to that, and that's the reason why so many of our patients, they do this process and they work with their doctor and they're able to successfully get off most, if not all, of their medications. Why? Because their bodies heal, right? Their bodies heal the way God designed them to be, and they're given the opportunity to be able to do that. So side effects of consequences of oxidative stress. If you look on this wheel here, you pick any organ system on there, you pick any disease, that's going to be oxidative stress. So for one person, it's macular. Can you do anything for macular degeneration? Well, let's test and see. First of all, do you have the nerve supply that goes to your eyes? Okay. And then second of all, you know, what's going on with your oxidative stress? You see that? So for some people, it might be that. Other people, it might be immune system or joints or kidneys or skin. It depends upon your unique body makeup and where you have subluxation in your body, okay? What the consequences are of oxidative stress. What are consequences of toxicity? So consequences of toxicity, or causes of toxicity, again, kind of building on the whole oxidative stress thing, right? Environmental toxins, benzene exposures. We're in Texas right now. We just finished this whole Ice-Mageddon thing, and everybody's having to rebuild, right? So everywhere you turn, you're walking into either a home or an apartment or a building where they've got new floors, new walls, right? And that puts off benzenes, it puts off toxins. So we're constantly breathing things in regarding as far as our exposure to toxins. It's not just the alcohol and the cigarettes. It's not just the artificial sweeteners or the personal care products. For some people, it's your garden or the foods you're buying, the pesticides, the herbicides, the fungicides, the things that you're getting on, you're not paying attention. You know, my best friend, she actually lost her brother because he didn't know this. He had a brain tumor and he used Roundup every day. That was his thing. He was in the garden every day using Roundup. No gloves, no mask, Roundup every day. Well, we know now, right, from all the lawsuits that that's such a serious thing. It's causing tumors. But we lost him, right? So it's very important just to know what are some of the causes of toxicity and just be aware of that, because the consequences are grave. For some people, it's cancer. Some people, it's depression that's debilitating. They can't get going. Some people, it completely trashes their hormones. You know, toxins mimic themselves as hormones. So very important to know and understand and be aware of things that you're exposed to so that your body can heal. Now, how do toxins come into the body? So toxins come into the liver, so your liver is your major detox organ, yes? So when toxins come in, they go through the liver first before you urinate or have a bowel movement, and they come out. That's the idea, kind of the idea behind that. When toxins come in, whether you put them on the skin, you breathe them in, or you swallow them, and they stop off at the liver, there's 2 steps that the body has to go through before it dumps them, okay? What's important about those 2 steps is there's required nutrients. So here you have, is my liver doing its job? Those required nutrients, for example, let's say you bring in the toxin and it gets to step 2 and you go, I don't like cruciferous vegetables. Well, guess what? Is step 2 going to work very well for you? So if step 2 doesn't work, then are you going to dump the toxins from your body? So if you don't dump the toxins from your body, what happens? They will hang out. They'll stay. And what do they form? They'll form skin masses or tumors or cysts on your ovaries or your uterus. Because unexplained cysts and fibroids and things that show up that shouldn't be there, your body was trying to dump it and your pathways weren't clear so that it could do it properly. Does that make sense? So very important about the function. And it's also why Max Living created this product, Detox System. There's 2 steps in here. Step 1 is on this side. Step 2 is on this side. Because you have to make sure you have step 1 and step 2 before you eliminate the toxin from the system. I also like this chart just to kind of give you a little bit bigger picture of how you are exposed to toxins. You can see on this side over here, toxins enter through. What did I say? Skin. So what have we been doing the past year and a half? What have we been doing? Sanitizer, right? So comes in through the skin, right? Comes in through the skin. What about all the cleaning things, bleaching, everything, right? So we're breathing that in, right? So these are all areas that we're bringing in the toxins. They stop off at the primary detox organ and they exit off. So you can see skin, you can see kidneys, you can see colon and lungs. And then also these toxins, the excess toxins that don't clear, they store themselves in fat-soluble toxins over here. They like to hang out where? Right? You reach down, you kind of grab that fat around you hate that fat. Why? It's there because it's trying to protect your nerve system. So you got a toxin, the fat wraps itself around the toxin. Well, if you remove the toxin, then guess what else will go away? Right? You can lose weight that way. That's why this is so beautiful. People get such great results in losing weight doing this program too. Bone marrow, liver, central nervous system, brain function. And then you got the water soluble on this side, joints. See, people that have problems with toxins, when you wake up in the morning, you're like, oh, my joints just hurt, right? Because those toxins like to hang out in those joints, blood tissue and muscles. And so then what they'll do, and the side effects will end up with, you look here at the bottom, every disease that you can think of. It hangs out in those areas because of toxins. Number 6 is GI stress. So GI stress, we can think of all the causes of GI stress. So with GI stress, you can see bacterial overgrowth. Major reasons why people get GI stress is because you get exposed to things and you end up taking like an antibiotic, and you know the idea behind an antibiotic is to wipe out the bad, and it also does what? It wipes out the good as well, right? So when you wipe out the bad and the good, then what happens is you can create gastrointestinal stress, so then it breaks down your ability to absorb nutrients, right? And sets us up for so many other things. So major issue. Also genetically modified organisms, right? Pain medications, that all those things can destroy and create gastrointestinal stress. And the consequences, you can go back and forth: diarrhea, constipation, autoimmune disease, every single skin disorder that you can think of, gut. And the other thing just to keep in mind also is your gut is where you make serotonin. You guys know what serotonin does? It's your happy hormone. That's right. Serotonin is your happy hormone. So you can expect mood-related issues when your gut's a mess as well too. So you want to make sure that you address that. Now what it looks like as far as normal function, you can see up in here, that's where digestion and absorption takes place. You guys have heard of probiotics? In the right here in the colon, you can see that's where the probiotics are in there doing their job. But if you take an antibiotic, you wipe out, again, the picture of the good and the bad, right? You're wiping everything out. What happens is all that fermentation backs up into where you should be digesting, absorbing your food, and now you've got the gurgling and the gas and the bloating, and you can't even understand why you have it. I mean, you can drink water, eat a strawberry, and your stomach goes, right? This is where you set yourself up for things like leaky gut, ulcerative colitis, Crohn's disease, all those types of diagnoses that you can hear of. And again, leading into stress hormone imbalance. So if you end up with stress hormone, there's a bunch of markers on here that'll tell us, that sets you up for stress hormone imbalance. And if those markers are broken, this is the stuff that shows anxiety, depression, sleep, mood-related disorders. This is a person that's just like flying off the hook, you know, with anger or frustration, things like that. They're very easily upset. This is the stress hormone imbalance. It also sets you up for fatigue and sleep problems and things like that. And what I say, gut is a huge component to that. So you got to pay attention to the gut. So we measured all these things, the stress hormones, and we'll be able to see what it is that we need to do, be able to balance those things out to give you the right protocol and recommendations for you. The next thing is fatty acid imbalance. So on your fatty acids, we can see, what's funny is we can see what you've been eating. There's nowhere to hide. I can tell what you've been eating. So you can't go in the room and go, oh, I've been eating perfect. Well, your test results will tell me that. So I don't even need to know the answer to that. The test will show me. And we can see what ratios you have. We can see if you set yourself up for inflammation based upon your fatty acids. And you guys know where fatty acids come from, right? They come from what foods? Fats. So your fatty acids come from the fat. So whether you're eating bad fats or good fats, that's what breaks down into your fatty acids. And again, we'll set you up either for autoimmune, heart disease, things like that, or even your joints to be broken down. We can see your cardiac risk factors. If you're at risk for sudden heart attack, these omega-3s and the ratios, if they're in the wrong ratio, this is the stuff that sets you up. And the good news is it's preventable and you can actually heal from it as well. So we want to know those things. Another thing that we tested for is your amino acids. So if your amino acids are out of balance, we can see whether you're able to detox. Sometimes your amino acids are the reason. Maybe you can't put on muscle. Maybe that's another issue, right? You can see fatigue, liver disease, mood and weight disorders, malnutrition. We see all those types of things on the amino acids. So we'll break them down, the essential and non-essential as well. You can see heavy metals we tested for. And I can show you kind of here on the list a ton of heavy metals that we tested for. And I think a lot of people are really concerned wanting to make sure we look at lead, mercury, and aluminum so we can see all those things. And then we'll be able to walk you through what we need to do about that, okay? Genetics. This is a fun one. So this is a new thing that we started testing for is genetics. And on genetics, you can see here, there's 4 different things. I love the quote from Bruce Lipton. He says, genes load the gun, but lifestyle pulls the trigger. And so what I like about this test is we can see whether genes loaded the gun. What did mom and dad pass on to you? And then we can also see what lifestyle you have to see whether you're going to pull the trigger to manifest what mom and dad passed you. Because it doesn't mean you have to. I mean, Bruce Lipton says 97%. What that means is it's totally in our power to be able to heal, right? And to be able to make sure we never manifest these things. So this first one's cholesterol regulation. And in this one, you can see based upon the chart here, we can see what the ratios are. The omega-3s, 6s, 7s, trans fats. We can see your risk factors and see where the patient is. And based upon that, that'll help us know whether they have an increased risk of stroke, whether they have increased risk of cognitive disorders or multiple sclerosis. Also, like in this case, we can see that this particular patient had an increased risk of Alzheimer's. This would be good to know, right? And we have a patient who had, dad had Alzheimer's, pass that on, and then the daughter takes the test and she sees that she's at risk. But guess what? It's totally in her power to never manifest that because her fatty acid ratio, we can measure that, right? That's empowering, yes? So many people walk around, I see the breast cancer one, people walk around, oh, mom had it, so I'm just going to go ahead and preventatively just go ahead and chop my breasts off because mom had it. That's the kind of fear that can go with this. But I want people to be empowered to know that you don't have to manifest this. It's totally in your power to be able to heal from this. Next one is MTHFR. So methylation risk factors, we can see whether you're malabsorption, vitamin B, where you're at with that, and if you need, maybe you're the person that doesn't eat enough foods that have B vitamins in it, make the green leafy vegetables, and you're like, I don't like green leafy vegetables. Well, if your test results come back and show that you have a genetic SNP from mom and dad, and that could set you up for not detoxing, and you can manifest a diagnosis, would you then eat your green leafy vegetables? Yeah, right? You'd learn to like them. You might even put Celtic sea salt on it, right, to make it taste better. All right, next one, methylation. So COMT, very, very important one. This one is going to set you up for nervousness, to being that person, whether you're just a nervous, anxious person. It also sets us up for estrogen types of disorders. So you see people with things like fibroids that are estrogen-related disorders. They're not able to clear them, and they actually hang out in there because there's the toxicity component in there. So if you pass this on, if you turn on the genes from mom and dad, you can see whether you've actually triggered it from the test, and then it sets you up for anxiety. It sets you up for a breast cancer risk. It also sets you up for fibromyalgia or pain syndromes, like having pain, like sitting, having that pain around your body and it's unexplained. And then the last one is TNFA, tumor necrosis factor alpha. That one is really just like it says, tumor necrosis factor. So did mom and dad pass me on a risk factor to create tumors? And is there something in my test that tells me whether I'm actively building those and turning that so that I manifest that? Super important. Again, sets you up for also a infection risk and tumor risk, Hodgkin's lymphoma, autoimmune, and ischemic stroke. So I'm going to hit a couple testimonies and then I'll show you kind of how we're going to end today, okay? So Patty, she actually did the tests, and after 2 months in her protocol, when she came to see me, she said, they told me I only have 6 months to live. And she did the tests, and got started. And 2 months into her protocol, she went from listless and not able to get herself up and going, just really looked gray when I saw her. And now she's got her skin's clear, her eyes are clear, and she told me she's running circles around her daughter. She has a farm, so she said she's running circles around her daughter. That's how dramatic. I just saw her actually a couple days ago, and she's already lost even more weight than she already had. Like, she just feels amazing, the difference in her body. So a vast improvement in her energy and her digestion. Amanda, she actually got started and was just feeling really focused, just mood challenged and wanting to lose weight. And you can see a dramatic, look at the difference in her picture, like just the before and after. And she's only like a month, 2.5 months in her protocol. She lost 11 pounds, but 11 pounds equals a lot of inches, especially when you do metabolics. And so powerful results for her: mood change, less inflammation, mental clarity, and weight loss. And she's only into her protocol. When we go back, you're going to see your test results. It's going to look like this. And we're also going to have that sheet that you have that we showed you at the beginning, but it's going to be highlighted, okay? So we'll show you that on yours. We're going to go over your individual recommendations that we'll do right now. And then you'll also have a metabolic specialist, somebody who will be your person that you can call upon when you get stuck or you're having questions or you're not sure, okay? Metabolic specialist. She'll be able to help you, walk you through if you have questions about your supplements or maybe a better routine of when to take them or what to eat, things like that, okay? So your metabolic specialist. And the last testimony I want to hit is Deb. So you can see Deb in this picture right here. But Deb actually came to us, and she actually, prior to even getting sick, she was an athlete. She actually loved to play soccer, and she was a fast runner and very athletic. And then one day, she's in a wheelchair. Just next thing you know, athletic, and next thing you know, she's in a wheelchair. She gets diagnosed with Guillain-Barré, and so her neurological system just shut down. And so she started under care in the office, and after getting started with her adjustments, then she decided to get tested. And after getting tested and really walking through the 5 essentials, she went from being in a wheelchair to a walker to now she's walking on her own. And you can even see evidence of her walking right here in these images right here. Just powerful. And so, in fact, lost over 30 pounds too. Another positive effect as well. So we'll go over this with you guys. You'll see yours will be highlighted and those be colors on there for things that are broken, okay? And we'll show you what you need to be able to do about that. We're going to give you your food recommendations. We're going to hit your genetic SNPs. So for those of you who had the genetics done, we'll go over your genetic SNPs and your risk factors for that. And then we'll be able to tell you what foods that you need to be able to do so we can take care of that. So if you're ready, we're going to go back right now. I hope this helped you guys. Bless you.